in San Juan. He then completed his internship in internal medicine at the University of Texas Medical Branch in Galveston, where he also completed his residency in neurology. After finishing his residency, he went on to complete his fellowship in medical and surgical management of movement disorders under Dr. Michael Oken, Dr. Hubert Fernandez, and Dr. Kelly Foote. Following his fellowship, he served as a faculty member of the Department of Neurology at University of Florida in Gainesville, and also held the position of Director of Clinical Services for the University of Florida Center of Movement Disorders and Neurorestoration, and was Director of the Clinical Research Center for Neurological Disorders, where he supervised over 50 clinical studies in a variety of movement disorders. Following his years at UF, he had the role of Chief of Neurology Services at our Orlando VA Medical Center. During his tenure, he established the Movement Disorders Parkinson's Disease Consortia site, where it was an center of excellence for PD, providing outstanding care to the veteran population with Parkinson's in a multidisciplinary approach. He's currently serving as a movement disorder specialist for the Central Florida population at Neurology 1, his practice. So we welcome you, Doctor. How are you today?
I am doing great, Anissa. Thank you for the invitation, and this is a great opportunity to be able to connect with some of the people in the community to talk a little bit about not only COVID-19, which I think we're getting a lot of that these last few days, but I will be available to answer any other questions that people might have. You know, happy to discuss anything about Parkinson's.
Well, just a bit of housekeeping for all of our participants today. So everyone starts off muted. And we're going to allow you to ask any questions that you may have for Dr. Rodriguez. If you want to either identify that you have a question in the chat feature, which you can open up. If you scroll down, there's a little box that says chat. You can wave your hand and we will call on you. So if we have several people that are trying to wave their hand at the same time, we'll just kind of have you identify your name in the chat and we will call on you. So just to get started, Dr. Rodriguez, you mentioned, COVID-19, and I think we've had a lot of information about Parkinson's and COVID-19 in terms of risks and all of that, but I'm kind of interested in maybe taking this a different direction on how COVID-19 or just being sheltered in place has impacted people in terms of symptoms. Are you seeing anything unique from this situation that we're experiencing?
So I think that the most common symptom that I am observing from patients is they feel a little bit too much isolated at this point, and some patients are becoming a little bit depressed, and they're becoming anxious because of the situation. While some of us have like at home, I have my wife and my kids, and when I get home, that keeps me very busy. A lot of the patients with Parkinson's disease, their children already left the house, so they live with their partner or their caregiver. So, there's a point that the visits to the doctor or maybe going to the grocery store becomes the social life for a lot of these patients. So, after 2 weeks into this, and now for some people it might be even longer, some patients are getting a little bit restless, a little bit anxious. So what I'm trying to recommend people, and this is what I am doing myself, is I started going through my Facebook list, and I started connecting with some people that I haven't spoken with in a long time, people that I went to medical school with, or I went to college or even high school. So it might be a good opportunity for you to do that. And you don't have to go even that far. This might be a good opportunity to call that old cousin that you haven't spoken with in a long time. Try to make that connection, because now we have the opportunity, right? We always complain that we don't have time to do things. Many of us now have the time, so it's a matter of becoming a little bit more disciplined and just taking the time and the energy to try to connect with these other people.
Right. So it's kind of a shift in our mindset. You know, we talk about not having time. Now we have time. And sometimes when we have that, we don't know what to do with it. So sometimes we're just kind of
Yeah,
frozen in place.
that is correct.
So with the situation of maybe being isolated and causing depression, you know, that's problematic with Parkinson's anyway, and certainly this could exacerbate that. And someone just asked me a question about apathy, which is very much an issue, but what about now in terms of being sheltered in place? So, you know, we've got time to do things, but how do we overcome the apathy to do it now that we have time to do it?
That's correct. So, you know, to some extent, we have to set and shift our mind into trying to get better, right? You know, and many times we become so consumed about the fact that we either have Parkinson's disease and we have diabetes and heart disease and things might not be going in the right direction. But for the most part, obviously, you know, the first thing that we need to realize is that unfortunately we don't have a cure for Parkinson's. We're working really hard to try to find that cure. But while that is happening, all we can do is try to have the best attitude to do those things that we believe might be able to help with Parkinson's disease. So, you know, I always talk about this 5 brain fitness rule, which actually, you know, they were put together by a good friend of mine. His name is Michael Hoffman, and he has these rules where he says that everybody must be doing some physical exercise in first place, okay? And you don't need to go to the fitness center. You can do this at home. You can have some elastic bands, or you can have some equipment that you probably already have. I bet most of us have some dumbbells in our garage, a little bit rusty. This might be a good time to go ahead and pick them up, bring them inside, clean them, and do a little bit of exercise. So it's important to do some physical exercise. It's very important to do some cognitive mind exercise. Just like you exercise your body, you have to exercise your brain. So the best way to do this is, you know, maybe playing some board games, some computer games, Sudoku. You know, I personally like to do crossword puzzles. So I bought a subscription from the New York Times, and there are just thousands of crossword puzzles there, easy and very difficult. Obviously, the component of social isolation is a big deal because we believe that socialization is very important. The ability to communicate with other people. And it seems that whenever you socialize, something good is secreted in the brain. So this would be a good opportunity, a good way. So learn how to use Zoom, communicate with other people, participate of these kind of events, because at least we see each other in our homes. We might be able to share some information. It is very important to sleep well, okay? And then it's very important to eat healthy. You know, when we eat healthy, we're talking, and this is my impression, it has to be a little bit of more organic foods and colorful food, raspberries, blueberries, and so on. I think that those items are going to be very important in trying to create a good environment for our bodies and for ourselves. And this is probably the best way to begin combating apathy, okay? Then the other thing is, it is true that we cannot go, you know, that we should not be going. You actually can go, but we should not be going to the grocery store or going to the gym or any other place that we might want to go. But it might be a good time for you to go outside, you know, take some fresh air. You know, if you have a garden, you might be able to work a little bit in your garden. If this is something that you're still might be able to do, because this will be the best way to try to combat apathy. If you stay home, sitting in the couch, with the news channel 24 hours a day, that's when things are going to get worse, because you're not getting any good news. Like everything that comes is about the problem. But actually, if you go outside, you might realize, like, you know what, it is a problem. We're trying to do the best we can, but we're managing. You know, I think that things are moving a little bit in the right direction at this point. So that's a reason for us to be excited and be positive and hopeful that you know, we might be able to see the end of this very soon. But it's critical once again, to go out, take a little bit of sunlight. You know, I believe that the sun might be one of the best antidepressants along with exercise. So all these things have to happen in order to try to combat apathy and trying to combat becoming depressed during this time.
So are you seeing any trends in your own practice with your patients that are struggling with depression and anxiety, and how that might be impacting their symptoms?
So you know what, I'm seeing it more than what I want to see it, okay? So right now we're doing a lot of telemedicines, and I think that what we're doing is we're taking, you know, at least in my practice, I'm taking this time to take care of patients that have very complex disease in terms of medication adjustments. So I am communicating with them almost on a weekly basis. So there's a day of the week that I communicate with the same patients to check how the medication changes are going. And I see that their attitude and their semblance has changed a little bit from the time that we started. They seem to be a little bit more sad than with initial visits, and I think that is beginning to take a toll. So I have to spend a little bit more time with them, just to let them know, you know, about the things that they can do to try to prevent becoming depressed. And it's a good time to begin involving the family members to make sure that they're initiating that phone call for them to be able to communicate and have a conversation and try to avoid becoming depressed. You know, it's a matter of social isolation, and this is not new. I was seeing a lot of this in people that were having drooling, that they decided to stop going out because of the drooling, for example. So I began to realize, like, this, you know, the going out and having those social interactions are very important. So now we're doing it because of the fact that we need to maintain the social distancing. So I think that after 2 weeks, we may start seeing a little bit of this in this population. Remember, people with Parkinson's, Parkinson's disease will increase the risk of you becoming anxious or depressed, and then adding the stress of the current situation is going to make things worse. So we have to set our minds in order to try to avoid falling into that deep hole where we're becoming depressed, we're not doing anything, that we just wake up in the morning, we turn the TV, sit in the couch until nighttime comes. So we have to set our heads to try to avoid that.
Right. So how about like your own experience so far with the telemedicine? So I know not all movement disorder specialists are utilizing it, but I know you have actively been doing so. So could you maybe speak to how that's been going and maybe some of the challenges that you have been faced with and overcome?
Sure, definitely. So it has been very interesting, and it actually has been now a very positive experience, okay? So let me tell you, 20 years ago, when I was doing my training at the University of Texas, we were doing telemedicine back then. And I remember that at that time, we were providing neurological care to the inmate population in the state of Texas. So there was a very fancy equipment that we had in our place, and there was another one in the other place where people were located, where the patients were located. But back then, this stuff used to cost about $200,000, $250,000 to have this equipment. But now things are different, right? Everybody has a cell phone. So the cell phone has a camera and it has a microphone. So technology has been able to allow for this to happen a lot easier. So when we talk about telemedicine, and even my office calls patients to schedule the telemedicine visit, they have been noticing some apprehension whether they might be able to do it. But the truth is that most systems are very simple. And I think that if you're able to use Zoom, you should be able to use the telemedicine service, because what will happen is your doctor will send you an email or a text message. And there is an area that is for connect, so to link the account. So all the patient has to do is press on that button, and then you're going to be connected immediately with the doctor, just in a system that is very similar to what we're doing right now. And what I try to make people understand is that when you're a doctor, 90% of the information that you need to obtain, you get it by talking, right? You know, are you wearing off? You know, for example, in Parkinson's, are you wearing off? Is the medication working? Are you depressed? Are you having hallucinations? Are you falling? So these are things that just by having a conversation, we can assess what the current situation is. And then I have a few people that they have been complaining of having a particular movement problem, right? So what we do is we tell the patient, you know what, put your cell phone or your laptop in the table or the countertop, and then move outside so I can see more of you and I can see the abnormal movements. And I have to tell you that 80 to 90% of the times we might be able to tell them, listen, what you're having is a dyskinesia, or that is a dystonia or myoclonus or tremors or whatever it is, and then we can actually make some medication changes. Things have been facilitated by the fact that we can send electronic prescriptions. So I go ahead at the end, I send the prescription to the pharmacy. I get a verification from the electronic system that the pharmacy already received that prescription, and they are going to fill the medicine for the patient. And patients can call and they can have the medication either delivered to their home, or they have the option of going to pick it up and they will take it to their car, or they can do the drive-through service. So they don't have to be exposing themselves. You know, the care will continue. And this is very important because many patients, what they have done is they have been canceling some of their appointments. And what is going to happen is when all these restrictions are lifted, everybody wants to come in, right? And it's going to be a lot more difficult. So my suggestion is, if your doctor allows or has the access to telemedicine, just make sure that you continue that regular follow-up. You know, it might not be 100% what you would like it to be, but it will be 90%, and 90% is better than 0%. So
Absolutely.
I'm suggesting people, listen, go into it. It is not difficult. And if there's a problem here and there, the staff will call you and they will tell you what you need to do to make sure that you're able to connect with the doctor.
So when you're seeing your patients via telemed, do you prefer that they are alone, or do you like the spouse or family member to be included?
Oh, you know what? Just like every visit, even here, I would love the caregiver to be there. Because when we talk about Parkinson's, there are always two versions of the same problem, right? So I want to know what problem the patient is having. I want to hear the patient's version, but I'm a strong believer. I truly believe that the caregivers are critical, and I can get a lot of more information from the caregivers than from the patient itself at times. You know, sometimes it might be hard for the patient to put the problem into words. So the caregiver will be the one that will be coming to the rescue, like, well, doctor, this is what I'm watching. And there might be things that patients might not see. You know, for example, patients might be a little bit dyskinetic, and they might not be aware of the dyskinesia, but the caregiver is the one that is going to bring this information. There is something called REM, behavior disorder, that is typically the caregiver, the one that complains about it because patients are not aware of what is happening. So my suggestion is always make sure that the caregiver is with them. You know, yesterday I had a funny experience where I had a patient with Parkinson's disease that I was evaluating via telemedicine, and the patient was by himself. And I asked him, you know, is your wife or your caregiver anywhere close by? And the lady said, well, doctor, yes, I'm here. I just haven't done my hair, so I don't want you to see me this way, right? So so she just stayed right behind the camera. And I have to say that she was totally involved during the visit, and the information that she was providing, you know, she was able to tell me that he was in the hospital for a week, which is information that he didn't convey to me. And she was telling me about an episode that sounded like a seizure, right? So we were able to make the proper arrangements to have that evaluated. And she was able to tell me about some of the problems that he was having that, you know, made me decide that the patient will benefit from having some physical therapy and occupational therapy once all this thing is over. So that information is very important. It's critical, actually.
Absolutely. So we do have someone who had an interesting question in regards to some of the symptoms we're seeing in COVID with the loss of smell and taste, which is also a symptom of Parkinson's. And they wanted to know if there's any link between the two. And perhaps that will not affect the person with Parkinson's in the same manner if they are actually affected by COVID. Could you speak
Yes.
to that at all?
So I'll tell you something important. So we're still in the learning phase of COVID-19. Okay. You know, remember that most of the information that we have is what has been available and published from the China experience. And then now we're getting some information from the Italian experience, right? But let me tell you what happened there. So, you know, the medical system in China is very different to our medical system, right? So the way that they evaluate patients, you know, they have really good doctors, but the kind of things that they do, typically they have one doctor managing the whole situation there, okay? Compared to the United States, where if you are in the hospital and you have a little bit of confusion, then they will bring the neurologist, the specialist to see you. So we will be able to obtain some other information that the regular doctor might not be able to obtain, the doctor that is taking care of that patient, just because it is not their expertise, right? You know, and this is totally normal. So in China, they have a team of doctors, and that doctor is going to take care of everything, like the neurological problem, the cardiology problem, just about any other problem that patient is having by the same doctor, instead of having a specialist just like here. And then the Italian experience is that COVID-19 came up as a tornado. They haven't had a chance to adjust. It's like it continues raining and the wind keeps blowing, and they just are trying to survive that event. So they haven't had time to sit down and talk about what is happening. But this is what I think that is going to happen. You know, in the past, there have been other pandemics where we know that those viruses affects the brain. And remember that the olfactory nerve is actually an external connection from the brain. So it sits on the top of the olfactory mucosa inside the nose. So it might not be uncommon for the virus to be able to attach to the olfactory nerve and actually start making its way into the brain that way. So we already have seen people with encephalitis secondary to COVID-19. So COVID-19 gets into the brain just like it gets into the muscles. It is just not for everybody. Some people with the flu will have a brain component, right? So some people with the COVID-19, we are going to start seeing some brain components. We're going to start seeing a little bit of a higher incidence of strokes. And this is not a surprise because other coronaviruses, other COVIDs in the past have been able to create this kind of problem. So it will not be a surprise. So the chances of somebody with Parkinson's getting this virus is the same chance as everyone else. But if somebody with Parkinson's becomes infected with COVID-19, these are the complications that we will see. So obviously, most people with Parkinson's are over 60 years old. And that is the population that seems to have more difficulty dealing with COVID-19. Okay, so that is problem number one, that patients are in that population. Some people with Parkinson's may have what we call a little bit of restrictive lung disease. So that is going to make things even worse. And then we're going to add on that the hospital systems, even though in the state, in the Central Florida area, we have done well, but some other areas are having a real issue. What is going to mount on top of that is that patients might not be able to get their medicines on time, okay? So now the Parkinson's disease symptoms will begin to decompensate, and that is just going to make things a little bit worse. And remember that every time we get sick, every time we are under stress, every time we are under anxiety, that is going to magnify the symptoms of Parkinson's. So it is not a permanent change or deterioration of the disease. Is mostly transient, but definitely it will make things more difficult. It will make it more difficult for patients to start improving and begin their recovery process. So every time we become stressed, every time we become ill, every time we are under bad anxiety or depression, that becomes a magnifying glass for the symptoms of Parkinson's disease. So I think that the most important thing that we need to do is just try to avoid getting sick. And this is where the recommendation from the CDC is coming from. So remember that this virus, it has no legs, it has no hands, and it has no wings, okay? So people have to become in contact with someone else that has the virus, or has to become in contact with the surface that has been infected with the virus, and then they'll have to bring it to them, okay? So usually this will happen when you go to the grocery store, when you go to a public place, you know. And let me tell you about one of the biggest experiences I have heard. So yesterday I was in a telephone call with other doctors, and one of the doctors that was there is one of those gurus, just like Dr. Fauci, that he's on the news providing a lot of information. So this other doctor is at the same caliber as Dr. Fauci. The issue is that he deals with problems in the brain. And infections in the brain. And he was talking about his experience because he was just recovering from COVID-19. So we're talking about the expert, you know, one of the top 10 guys maybe in the nation about dealing with infectious disorder, and definitely one of the most important people dealing with infectious disorders in the brain. He was telling his experience that at the height of the coronavirus cases in Wuhan, he was there. So he went there to find out what was happening. And while he was there, he did not get infected. He comes back and he goes to the hospitals in New York and all these places, and guess what? He did not become infected. So finally he shelters and he decides to go to the grocery store. And it seems that that is when he became infected, because now you don't have this attention that I cannot bring my hands to my face, I cannot touch this, I cannot touch that. So while he was being the normal guy, like he was not wearing his doctor, an infectious disease expert hat, that's when he became infected with the virus. So it is very important that we avoid just getting outside, start going to the grocery store. You know, as much as you can, use those services where they will deliver the package to you. You know, usually what I'm doing is I have a Walmart very close to where I live, and they will pick up everything that you need. So you go to the app in the telephone, you ask for everything you want, and you set up a time to pick it up, and then you go there, you just open your trunk, they will drop it there, and that's it. We are done. So, you know, these kind of services, not only Walmart, I'm sure that many other places have them available. I just found that it was a really good opportunity for people to avoid just becoming in contact with other people that may be infected with the virus. It's not that we don't want them, it's just that if we actually can get people in their homes for 4 weeks without going out, this thing will be over probably by then. So so you know, that important and that significant it is for us to just avoid getting infected from the beginning.
Awesome. So stay home and wash your hands and quit touching your face. Key. So there's a couple of questions in relation to going back to the stress topic. So one was, is stress impact on Parkinson's on all symptoms or mostly motor symptoms? And then in a follow-up, there's another question regarding to stress, but let's answer that one first.
So you know what I believe is it can be a big impact in all symptoms. Okay, so the tremors will get worse. I will see, and this is very well known, people have more freezing of gait when they're anxious than when they are not. Okay, so all the symptoms of Parkinson's, insomnia, sleep will become more of an issue. The tremors, the walking, and then the way that people interact with other people, everything will aggravate with the stress. So that's why, when people are under stress and they have anxiety, we as doctors need to follow that closely, and we need to treat it, because we know that it will just magnify. It is not a permanent damage to the brain, but it will magnify the severity of the symptoms.
Right. So in follow-up to that, so someone had mentioned that they have broken out in a rash that doctors cannot find the source to, and they're wondering if that could be stress related.
So you know what, I obviously that would be hard to say without looking at it, but if it is a rash only in one area, the main thing that needs to be evaluated is for shingles, okay? And that will happen at any time. And it might be a little bit difficult. If you have someone else at home that might be able to put the camera on to show that the doctor, that will make things easier. I think that a good opportunity, if there is a rash like that, is try to connect with the dermatologist. Dermatologists have been doing a lot of this telemedicine, because they just have to look at the lesion in the skin, and they might be able to assess, with probably 80 to 90% certainty what the lesion is. So even though stress, some people get a little bit of rash or skin discoloration with stress, the presence of a rash means that there is something going on. So that should be something that should be discussed with the doctor.
So because we're all operating in such a high level of stress right now, excuse me, so are you noticing any unique presentations of that? I mean, obviously, anxiousness and upset stomach and sleep disturbance and all that are your normal stress response, or what we consider normal, but is there anything new that you're seeing creep up through all of this?
So you know what, I've seen more patients complaining of headaches, and I have seen more patients complaining of trouble falling asleep. Once they fall asleep, they will sleep the rest of the night. But those are the two things that I'm seeing more frequent. Like, hey doctor, by the way, I'm having a headache. And over and over doing the telemedicine visits, I see that complaint, and it's a low intensity nagging headache. And many people say, and if I take a Tylenol, it will get better. And indeed, people will feel some improvement, but that's something that I see. And then people go to bed, and the mind just starts working and running around all this, when is this going to be over? What is going to happen? And am I going to be infected or so? So that would be the other common thing that I'm observing in people. And then, some occasional cases, I see more people becoming a little bit forgetful of taking the medication on time. So they're complaining of off periods. But for the most part, it would be the headache and the trouble falling asleep.
So how about the impact on REM sleep behavior? Does that increase greater with stress?
You know what? That's a good question. I don't know the answer to that. I would not expect a reason why. However, something that I have observed is people with insomnia, sleep and Parkinson's go hand by hand. If people with Parkinson's do not sleep well, they tend to have a rough day, a day later. So that the next day is very difficult. And then that might actually begin to create a cycle where people will have more insomnia, and things are going to get worse in terms of the way that they feel, developing more anxiety, developing some depression. So I don't think that the REM itself might get worse, but I think that it might create a chain reaction where some other symptoms of Parkinson's disease are going to get worse.
So I guess just to kind of take this a little bit further. So obviously stress can impact our ability cognitively, lack of sleep, so anxiousness. So this really could be a recipe for maybe seeing some increased cognitive changes during this time,
Yes.
possibly?
Yes. That is Correct. So now that you mentioned that, some patients will start complaining of more difficulty with multitasking. Okay. So that's something that can be observed. And some other people might have a little bit more of the I go into a room and I forgot what I was going to do there type of syndrome, right? So those might be a few things that we might observe with this. And even though, most people will blame that into, well, I'm just getting older and this is just what, how life will be from now on. But no, sometimes, the anxiety and the stress and the not sleeping well will cause a little bit of losing focus and a little bit of distractibility. So these kind of other symptoms might start happening.
Right, but it can be potentially resolved if we can reduce our stress and
Definitely.
okay, that's good. Just making sure that there's not some questions out there that you all have. Feel free to raise your hand if you have a question for Dr. Rodriguez, or put it in the chat. We are happy to take any questions anyone might have. In a second.
I think we have one from Teresa.
All
Were
right.
you raising your hand, Teresa? Go ahead.
Oh, I'm sorry.
Oh, okay.
Nope, okay.
Yeah,
So
I was gonna say when I get up in the middle of the night, I have a hard time going back to sleep.
Yeah, so that could happen as well in people with Parkinson's. The normal time frame, if you wake up in the middle of the night, let's say to go to the bathroom, right? And then you go back to bed, you should be able to fall asleep within 30 minutes, right? That's the typical normal time. But we have a lot of patients that they just cannot go back to bed right after. It becomes a major challenge. I hear you. And sometimes, sometimes maybe having a little bit of melatonin when you go to bed might help with that problem, because it will set you up for you to be able to sleep better all night long. There's something called the sleep architecture. And the sleep goes through multiple stages. And sometimes when you wake up in the middle of the night, suddenly that sleep architecture gets out of place. So sometimes things like melatonin can help keep things simple. And it's a relatively benign supplement, and most people are able to tolerate it fairly well. So that might be something that you can check, okay?
all right, so we did have a question in regards of Xanax being used during this time for stress and anxiety, and if that's a safe medication.
So you know what, I'm the kind of doctor that I try to use the least amount of medicine. So Xanax is a quick fix, but it's not a good treatment in the long term. And the reason is that it can cause some dependence, physical dependence on the medication. It's very short lasting. So for somebody that is having an issue acutely, it might be a quick fix. But if the stress and anxiety becomes more chronic, right? Then I think that other treatments like, I don't know, maybe sertraline or venlafaxine at a low dose might be a better option.
All right, so someone says they like natural calm for help with anxiety and sleep. So any thoughts on maybe some over-the-counter or more natural products, supplements?
Definitely. So I personally like to use chamomile tea. Okay, that's my favorite one. And then there is a supplement called ashwagandha. And that is very good for stress and to keep you calm. So so that's something else that I use in my house as a daily supplement during these times. Valerian root will be a good option as well. And such as is turning the TV off every now and then and stop getting this continuous impact from the news.
All right, so Marie was asking a question. I don't know if you want to just be unmuted and ask your question, Marie. She's
Okay, am I unmuted right now?
You are unmuted right now, so go right ahead.
Okay, my husband, who is 87, we have a caregiver from VA And we got very, very anxious when this first started because we were doing self-quarantine, making sure we stayed home. But we got nervous that maybe the caregiver, even though she is conscious of everything, her family might bring it to her. And because of the number of days where the contagiousness might come in factor, I was afraid that she'd bring it into my husband. Am I being unrealistic?
You know what? I don't think that you're being unrealistic, okay? So, your question has been a very common question about among some of my patients that they have some help going home, uh, some caregivers or assistants, CNAs, and so on. I'll give you the best example. You know, my personal experience. So I do have a physical therapist that goes to my house to help with my mom, right? You know, to do the therapy. And you know, when I saw that those numbers of people becoming infected started going up, at that point the question became, you know, is this something that is life or death, right? You know, what would be the result of not being able to do this, right? So let's say that if you have a caregiver that helps with simple things and you think you might be able to handle them without her coming in, I believe, and this is my personal opinion, now we're talking about opinions, right? I believe that that would be the right thing to do. However, let's say that your husband is bedridden, right? And you need somebody to come and help you with hygiene and changing him and getting him from the bed to the table, something that you cannot do on your own. Now, in that case, then it is worth to have your caregiver come in. So something that I will try to ask is, number one, is make sure that it is the same person all the time.
Yeah.
Number two, sit down and have a 3 minutes conversation with that person and telling them, listen, this is difficult and it's not only for us, but it's for you as well. So let me tell you what we are doing from our standpoint. And I'll tell them, listen, we are not going to the grocery store. We're not doing this. We have people come in or my children come and deliver things for us to avoid that. And I need you as well to try to do your best to, you know, so that when you come in, you wash your hands. And then I will ask them to wear a mask. I'm a strong believer. I think that the best use of the mask is that if somebody's infected, that it will not be coming out, right? It will not be exposing others. So that's what I will do if you think that this helps, is really needed. If it is something that can be put on hold or at least minimized, right? You know, we can either expose your husband 3 times a week versus once a week, right? So these kind of things will make a little bit of a difference. But that's, you know, it will be something that you will have to think about and make that decision.
Okay, we've been working with the home care agency to let them know at this point, you know, we just felt more comfortable without, you know, the help. And I coordinated with the caregiver, I mean, the aide herself, so that she didn't think I was just, you know, deserting her, but we just were so concerned. And they said they were having a lot of people in the same nervousness. So
you are not the only one, and you should not feel guilty. You know, it's the right thing to do at this point. Okay.
All right, so we have some several questions that are waiting, but one that's somewhat tied to Marie's question from Jill. Or any thoughts on ALFs? She's been debating on bringing her mom home to reduce her risk of exposure from the caregivers there, but she's not sure she can take better care of her at home. So might not notice symptoms, etc. So any thoughts on that?
So let me tell you, I think that depends on the facility, but let me tell you what I have seen, okay? At least in multiple ALF nursing homes here in the Orlando area. I'll give you the best example. Yesterday, I tried to bring a patient out to do a brain scan, and they called me from the nursing home and they asked me, is that life or death, doctor? You know, because if he goes out, it doesn't matter what it is. If he goes out, when he comes back, he needs to be isolated for 14 days. in his room and he will not be able to come out. So what these places are doing is that they're not allowing other people to go in. They're minimizing visits. My recommendation is for them to stay at the nursing home if you have seen that they already put a plan in place to avoid people that might be potentially infected with the virus to come in. So most places are not letting anyone else go in. Only the food people come in, they drop the boxes, everything gets clean and sanitized and is brought in, but they have minimized all the visits. So they are still able to maintain some of the social interactions, keeping some social distancing. So that might not be actually a bad idea. They might be able to do better at home than at the nursing home or the assisted living facility than going home. And my suggestion is you just communicate with them using maybe FaceTime or Zoom or whatever tools might be available for you to be able to communicate with them.
And just for anyone out there in the audience that have loved ones in a facility, we do offer on Fridays at 4 p.m. Eastern, 1 o'clock. I have to remember how to convert to the different time zones. And Pacific for those as a support group for those who have loved ones in facilities. So there was a question from Pamela, and then we'll go to Sheila. So Pamela wanted to know if there's a negative impact to delay medication.
Oh, that's a great question, right? So historically, we believe that delaying medicines, and I imagine that we're talking, Pam, about whether to start medicine to treat the Parkinson's or not, right? That's the most common question, one of the most common questions. So let me tell you what we know, okay? So historically, we used to believe that we should delay using Parkinson's medicine for as long as we can because the medication was going to stop working, or the medication was not going to help people any longer, or we were going to run out of it. But let me tell you actually what we have learned. So in first place, we know that medicines for Parkinson's are not toxic to the brain. We know that as a fact from multiple studies. And the question is, does medicine make the disease move faster? And let me tell you about a study that was done recently. So what they did in that study is they compare people from some of the African nations. So some people with Parkinson's disease in some of the African nations, they do not have access to levodopa until their condition is bad. So it is not until they are 5 or 6 years into their disease that they will be allowed to begin taking the medicine. In their case, it is because there's not enough medicine for everybody, okay? So they compare that group of people that were not being treated initially with people from the rest of Europe and America that begin to take the medicines after the diagnosis. And what they found is that all the things that they were trying to avoid were happening just about the same time. So the answer to that is, we don't need to delay medicines. If you need to take the medicine, you should take the medicine. And I always give this example that if you purchase a home and you delay providing any maintenance to your house for 5 years, then after 5 years, you will try to fix it, but it will never look the same as if every month you were doing the proper maintenance to your house, right? So the same thing happens with the body. Maybe by then, the patient has some deformities in the hands, maybe some deformities in the feet, some people have a little bit of deviation of the trunk or more of a stoop posture. So I will not delay treating people. I will just start treating them, letting them go to the fitness center and exercise properly and letting them having a good life, right? And I think that would be the best way to treat people with Parkinson's at this point. Just don't overdo it, okay? Just don't give too much medicine. Some people want to look normal. I tell them, you know what, that might be just too much. We might regret this in the long term, but we should not avoid treatment at this point.
Awesome. Okay, so let's go to Sheila. She's been waiting so patiently.
And Sheila, I think you have to unmute yourself. Oh, you think your microphone is broken. Okay, Sheila put her question in the chat. Let me find it. It had to do with
Pneumonia.
yeah, a link between COVID-related pneumonia and pneumonia with people with Parkinson's.
Okay, so any pneumonia is going to make things more difficult for people with Parkinson's, okay? So there is, if people with Parkinson becomes infected with COVID and they have a pneumonia, it might be more difficult for the patients to get over it compared to somebody of the same age that do not have Parkinson's, okay? So the person with Parkinson's might have more complexity, more difficulty getting over the pneumonia compared to somebody that does not have Parkinson's. So there is not a particular increased risk. So people with Parkinson's are not more likely to develop that pneumonia than people without Parkinson's, but people with Parkinson's, if they have the pneumonia, might actually have a more difficult course or more difficult to treat, or if people with Parkinson's eventually becomes intubated, it actually might, in my impression, it will be more difficult to extubate compared to somebody without Parkinson's. And once again, this is from the experience that we have with the flu and we have with just any other pneumonia that we see in the hospital.
Okay, so there was a question earlier that I want to go back to. This says, I'm a caregiver for my husband. He's having the sleeping issues. I noticed that when he's sitting in his recliner reading, that his feet are moving constantly, and he's had the jaw movement issue for 7 days. I try to keep a stress-free environment for him, but she works in the hospital and knows that this concerns him.
So you know what, those are those situations where maybe a telemedicine visit with your doctor can help. It might be a dyskinesia, what he is having, okay? And, pertinent information that your doctor will need to know is, when is the patient taking the medicine? And then when is the movement that you are observing beginning, okay? So a common finding in people with Parkinson's disease after 4, 5, 6, 7 years is that after they take their medicine, the feet are moving side to side, and they might have a little bit of movement of the jaw, okay? So that would be a levodopa induced dyskinesia. And that might be just what is happening. If it is happening, let me tell you that in most people, it is not a harmful thing. It can be bothersome, it can be annoying, it can be embarrassing, but it is not going to hurt them per se. However, we obviously try to minimize, because for some people, it can cause a little bit of problem with their ambulation. It may make them lose their balance. It can affect the ability for them to eat properly. So that's what we can see. But it might be a dyskinesia, levodopa-induced dyskinesia. That would be something that the doctor can take a look at it via video and will be able to give you an opinion.
Wonderful. So we're getting close to the end of our hour. We have about 5 minutes left. Do you have any other words of wisdom that you would like to impart to our audience today?
Definitely. So number one, exercise at home. And there are multiple videos online that, from many organizations and other people with Parkinson's and the Brian Grant Foundation and many others that might have something that you will be able to access and look at it, okay? So that would be number one. Number two, establish a line of communication daily if you live by yourself with your children or someone else, a good friend that knows how things are going, okay? Number three, learn what are the resources in the community to help you in case that you need something to eat or you need to go to the grocery store. You are not going to believe how many people have been offering themselves to do a grocery store run or go pick up your medicines at the pharmacy. So trust me, you will find somebody that should be able to help you, okay? Then, if you need to go outside, make sure that you wear a mask, okay? And we have not been mandated to wear mask at this point, but I personally believe that by wearing a mask, the first thing that would happen is if you are infected, then you're not going to bring it out, so you're not going to expose other people. But I still believe that having that physical barrier, right, at least might be able to help some. So while the information is spotty and it's not completely clear, I might as well stay on the safe side and I will use it. So I have a mask here, right? And then I have my mom at home sewing some others for other friends and the people in the clinic when they come here. So that's something that I will do. And then please do not spend the whole day watching the news, just talking about what is happening in New York and how bad things are, because that is just get you into that depressed and anxious mood. So don't do it. Exercise a little bit, go outside, take some fresh air. You can walk in your community, just maintain your distance, 6 feet distance from other people. Maybe sit down, make an adult drink and sit in your backyard and look at the birds and look at the flowers. Maybe have an herb garden, where you will keep your mind busy. That is the right thing to do at this time, because I am afraid that we're going to be probably another 2 or 3 months into this, right? So I don't want to scare you. I don't want to scare you, but it might be possible. And then what is going to happen, even as we get over this, people are not going out and take their mask off and start shaking everyone else's hand, right? It's going to be a period of adaptation again over the next year or so. So it's going to be a long process, and you just have to be prepared and you have to know what to do, and you guys will do well. Listen, I'm sure that everybody that is connected today have gone through a very, very difficult time before, right? And if you look back, you would probably say like, you know what, this shall pass too, right? So just like those difficult times, we were able to get over them. We'll just, we'll get over it again. And, we're going to hug each other. We're going to shake hands, high five each other. And we're going to look back and say like, wow, that was tough, right? So it's very important that those of you that love to pray, continue praying for everybody. And you know what, I think that hopefully anytime within the next 2 to 3 months, we'll be allowed to go back to our favorite restaurant with a friend. And within a couple of years, the whole thing will be back to normal.
So you brought up some great points. And I love some of the comments, watch old movies, go out and get some fresh air, do things that bring you some joy every single day. Find opportunities to laugh. Just get out there and do everything you can to kind of just get past the 4 walls and the negativity in the news, right?
Yeah,
so
listen, I just read a comment about somebody growing their own mint in the backyard for mojitos. So
that sounds good.
That's funny.
Well, Dr. Rodriguez, we thank you so much for your time today and all of this wonderful information that you've given us, and all those that are out there watching and listening today. If you want to know about some more resources and different programs and our online support groups, please visit our At a Glance page on our website. There's a lot of great information. We thank you so much for your time and wish all of you a wonderful day.
Thank you all. Thanks a lot. Bye-bye.
Bye to everyone. Thank you.